thank you all for giving up your time to come and listen to me talk about dementia prevention and good support. I hope it'll be interesting. I hope it'll kind of raise some questions for you and maybe provide some answers. And I can't see any of you, so that's probably quite a good thing, but hopefully you can hear me okay. And I'll just get started. Okay, so straight away, my slide won't move on. Bear with me, sorry. There we go. Okay, so just a little overview of the session. I thought it might be helpful or interesting for you to hear a little bit about what a career in dementia research can look like. And then I thought it might be helpful to have a little think about what we know about dementia. And I stress we because I want you to get involved and share what your thoughts are around dementia. Then look a little bit about what we think about how dementia can be prevented. I'd then like to think about to share a little bit about how I think things can be done to support people living with dementia, and that's really important, and that links in really strongly to my current work. So I thought it might be helpful just to tell you a little bit about who I am and what I do here at the university. So I'm a senior qualitative researcher in health services. So I work in the Faculty of Medical Sciences as a researcher only, not a lecturer. And I've been doing that for about 20 years now. And the focus of my work has been on proven post-diagnostic dementia support. So that's when people get a dementia diagnosis, helping them to find the right care and support and making sure that we can help to support services to improve and to work with people living with dementia and their families to find out about what services can do for them and how they can be improved to meet their needs. So I feel really strongly about that. I like to promote living well as possible for people living with dementia and to raise awareness about dementia in lots of different communities. And I'm very privileged to see I work with often underserved communities, and that means people who might face some sort of disadvantage, and that's really important in my work. And I do little bits around dementia prevention and dementia risk. And if you want to look at my profile, I've put the link in there. And I thought it might be maybe interesting or helpful to tell you a little bit about my journey as a dementia researcher. So I'm from Newcastle, obviously, if you can't tell by the accent. I went to Long Benton Community College, as it was called, Long Benton High School, where I did A levels, including sociology. And that's where I really found out I had an interest and a passion for kind of learning about how societies work and how people interact. And I really got really interested in that. And although I got a good A level and good A level results, decided I did not want to go to university at all. I wanted to go and get a job. So I got a job at a different university, Northumbria University. I did that for a year and thought, no way, I want to be a student as well. I can do this. So I moved to Glasgow, went to Strathclyde University to study sociology. Really enjoyed that, finished up, not really knowing what I was going to do, so decided to do a postgraduate certificate in primary school teaching back in Newcastle whilst living in Glasgow. And that didn't work out particularly well for personal reasons. And I got a full-time job, didn't really think about an academic career at all, had my degree, thought that's great. And then for personal reasons, moved back to Newcastle and a job came up in the Faculty of Medical Sciences and took that job on. It wasn't a research post at the time, but worked with a really fantastic boss around improving the care that private hospitals could give, not to people with dementia, but in general. And he suggested that I do the Masters in Public Health to support that role. And then that launched the start of my academic career. I then went on very quickly to specialise in dementia care research. Didn't think that was the area I wanted to go in. At the same time, I think I was doing a project around tonsillectomy in children, so it could have went one of either way. But really enjoyed research I was doing around dementia care and decided that was what I wanted to specialise in. And that's a picture of me graduating with my PhD. In 2018, I think that was somewhere my 11-year-old self at Long Benton High School would have never thought I would have got to. So not the most straightforward academic career by any stretch of the imagination, but it's not always that straightforward. And you don't have to decide now if you want an academic career. I think you've just got to go with the flow sometimes. So, just a little bit about what I do as a qualitative researcher. Essentially, I spend a lot of my time talking to people or watching how services work in practice. So, doing observations. And I do mainly qualitative research. So, that's about engaging with people, engaging with services, finding out what people want, what people need, what services deliver. And I really love that part of my job. I get to work with lots of different people. I work with people living with dementia and their families. I've worked from people from pre-diagnosis through to the end of life. I work in a range of healthcare and social care settings like the NHS, care homes. I've worked with universities in the UK, lots of different universities in the UK, and I've been lucky to have international collaborations as well. One of those was partly developing an international website for people living with dementia. My PhD was on hospital discharge for people living with dementia, and I had really enjoyed my time that I spent working on those inpatient wards to improve hospital discharge for people. I've worked in GP practices, and the work I do at the moment and enjoy immensely is work with football organisations, and I'll tell you a little bit about that more. I teach infrequently, but sometimes I do, and that's usually with postgraduate students, and I have PhD students. And another part of the work that I really enjoy is communicating the research findings because it's fantastic to do research, but for me, it's really important that our findings are shared with the right people to make a difference. So these are some fun things that I do. So it was really great when we had the website Forward with Dementia and it had a campaign. And this was my our campaign poster, which had been co-designed with people living with dementia and family carers, an international project. And that was one of our billboards on Biker Bridge of all places. So that was a real buzz for me when that was up there. Not my project, but a co-participant on that. And one of the other pictures represents the work I do around football and dementia, and that's at Newcastle United Foundation, and that was our last Christmas event there. Really love the public engagement work I've done with them and the evaluation work, and that's led on to bigger things. And linked to that down at the bottom, I've done really exciting things like work with illustrators, things I thought I'd never do to try and share our research findings. And then I have to work on more academic outputs. And that's just an example of a paper published in a journal. I think I've got about 40 publications in journals and have to keep working on them. That's something I do as part of my work and dissemination and sharing information. And then things like public engagement, again, events. Just last month, I managed to get together representatives from Newcastle United, the Foundation, Foundation of Light, Carlisle United, and Middlesbrough Foundation to share best practice on how they can improve their services for people living with dementia. So these are some of the things that I really enjoy and doing as part of my job. And some of the work that I've been doing recently around dementia support through football has been picked up by the media, by the Evening Chronicle, and by the Guardian as well, which was very exciting when they interviewed me for half an hour and then literally like had a sentence in one story. But it was still very exciting to be chosen by the Guardian to contribute to an article. So that was a real highlight for me. And I'm really lucky to say that my research has taken me around the world, physically and in terms of collaboration. So the red stars, I think, capture most of the places where I've went to work either usually to present research findings. This year I've been to Italy, lots of different places in the UK. Um, I've been to Taiwan, I've been to America. Um, So that's a really good kind of perk of the job. But it's not just a perk of the job, it's making sure your research findings are shared internationally, which is really important because dementia is an international and global issue. I worked on an international project with Poland, the Netherlands, Canada, and Australia, but that was during the pandemic. So unfortunately, I never got to go to any of those places. And I was also due to present at an international conference in Singapore. And that didn't go ahead because it was due to be held about a week down after lockdown was imposed. But I feel very privileged to be able to go to all these places and share my research, but also to learn about what research is going on internationally. So that's kind of a little bit about my career as a dementia care researcher. So I'd like to kind of stop talking for a little bit and think about what we know about dementia. And I'm going to test my tech skills here. And I'm hoping you've all got your phones handy because what I'd like you to do is think about what you think when you hear the word dementia. And that might be based on what you've seen on social media, the telly, or within your own families, or whatever it might be. And if you can scan that code and just put some words in, I'll have a look and see if I can sort out the tech and bring up the Mentimeter. Uh, Excellent. Let's get rid of that. Oh. So I can see by this already, and I know you're all busy putting in information that some very emotional things in here. There's family connections. There's people feeling frightened. Um, People seeing decline, loss, a lot about memory, confusion, and forgetfulness. Vulnerability, that's really interesting. And moving back to childhood, scary, forgotten. And all these are really, I feel quite emotional reading these, actually upsetting. But it sounds like you've all got quite a reasonable understanding of what dementia is here. So I really appreciate you sharing, especially when these are from personal experiences. Palliative there, that's really interesting. Somebody's put that in there. It's a very kind of medical term. Impaired judgment. Okay, well, thanks so much for sharing all of your kind of thoughts and ideas. And hopefully I can talk about some of these as I go through this, but also maybe put a more positive spin as well on some of these aspects. So I'll try and go back to the presentation now. Thank you. Right. There we go. I'm just trying to get it back in presenter mode. I've lost my mouse. There we go. We're back in. So thank you very much, everybody. And I might try another one of those at the end if it works okay. The next thing I'd like to do is I'd like you to think about some of these dementia facts, and I've put them in inverted commas because they might be true, they might not be. And you've probably spoke to some of these when you did that lovely Mentimeter there before as well. So I'd like you to do a poll, and I'll launch this in a second. I want you to just answer true or false um, to what you think about whether if dementia affects how your brain works, about whether about 1 million people in the UK are living with dementia, about whether it's true if 1 in 3 people born in the UK today will go on to develop dementia, whether dementia can be prevented, that dementia only affects older people, that there's nothing that can be done for people living with dementia, and that currently there's no cure for dementia. Right, next technical challenge. Let's try and launch this poll. Uh, Matt, I'm just going to ask you, has that launched?
I can't see from my end.
Okay, let me try.
I'll
Relaunch. Let me try that. Can you see it now?
yes, I can.
Fantastic. Hopefully everybody can see that. Don't spend too long on your answers. Just go with your gut feeling. Um, some of them are a little bit on the trickier side. Some are quite obvious. Brilliant. I can see people are putting some results in now. Thank you. This is exciting because I can watch them coming in live. I'm easily pleased. I'll just give a few seconds for, I think we're nearly 100% in. Okay, fantastic. So I'm pleased to say that nearly everybody is unanimous in that dementia affects how your brain works. And we'll talk a little bit about that as we go forward. Less certain on this answer, but yes, it is true that 1 in 3 people born in the UK today will go on to develop dementia. That is a lot of people. And that's just UK figures. But it's pretty similar worldwide, if not more in lower middle income countries.
Sorry, Marie, if I just jump in there,
Yeah.
if you click end poll, you should be able to share the results so everybody can see what
Oh, fantastic.
if you click. There you go. Everyone should be
Ah,
able to see now.
lovely. Thank you, Matt. I thought I was
Yeah.
sharing. Thank you. So everyone should be able to see that. Quite split around whether dementia can be prevented. So that would be interesting to discuss that a little bit more. Great that most people have picked up that it's not true that dementia only affects older people. And I'm really pleased to say that lots of people believe there is something that can be done for people living with dementia. And most people are aware that there's no cure for dementia. And that's why to me it's so important that things can be done. And around 1 million people, yes, that is true, sadly, and it's probably a gross underestimation. Well, thank you for filling in that poll. It's been really nice to have a sense of what you know about dementia. I'm just going to stop sharing that now. And I'm going to skip through the next few slides because these are just my placeholders in case the poll didn't work. Skip, skip. Okay. So when we think about dementia, when we did the kind of Mentimeter, lots of people talked about memory and decline and loss, and that is very true. But I think what it's important to know is that there's different types of dementia. Dementia is just one big overarching term for about over 100 different conditions, which sounds like an awful lot. But there are kind of 4 main types of dementia. Um, Alzheimer's disease is about most common with around 70%. Vascular dementia, which can be caused by other conditions like stroke commonly. Lewy body dementia and frontotemporal dementia, which often affects different parts of your brain. And oh, no, wrong slide. So I think it's really important to recognize that dementia is just a term for lots of different conditions, but they all have things in common, which is around deterioration of brain and brain function. And thinking about how many people it affects, and because I do lots of work with football, I'll often try and help people visualize it in terms of filling football stadiums. So in the northeastern Cumbria, which is a fairly big region, there's over 28,000 of people over 65 with a diagnosis of dementia. So that's quite a lot of older people in one region. So that's like filling Norwich's stadium at Carrow Road, for example. Some of you might have been there, I don't know. But if you included all the people who don't have a diagnosis as well, that would be 41,000. So that's like Stamford Bridge and Chelsea. That would be like filling their whole stadium. And if football's not your thing, and I know it's not for a lot of people, thinking about all the people in the UK who have dementia, again, it's probably a massive underestimation. But if you think of the whole of the city of Glasgow, which is the fourth biggest city in the UK, it's like filling that whole city with people living with dementia. So that might just help you visualize how many people it actually affects day to day. And that's just people with living with dementia as someone with the condition. In addition to that, it's often family carers providing the bulk of care and support. So it affects a lot more people. And these are some of the warning signs of dementia. And I wanted to put this here because this kind of highlights that it's more than just about memory. And I do stress that these are just warning signs. Um, So if you notice a family member experience these things, it does not mean they're going on to develop dementia. It just means they could do. So, for example, misplacing things. Everybody can do that from time to time. Problem keeping track of things, me all the time. I'm sure some of you will find it difficult to keep track of things. Poor judgment, changes in mood and behavior that can affect us all. But if somebody's experiencing more than these things and they're happening all the time, it's not just the occasional, where did I park my car or where did I leave that? Or occasionally feeling down or withdrawn. It's when these symptoms are in combination and are going on kind of continually and often getting worse that people realize that these might be signs of developing dementia. And it's really important that people kind of act fast when they realize these are happening. And I put this in for you, that not necessarily to do now, but it's a really nice way rather than me trying to explain how a brain works because I'm not a clinician. That's not what I do. I'm a social scientist. And I could have put a picture up of the brain and kind of labeled it. But why do that when Alzheimer's Research UK have a really nice interactive brain tour and which tells you about different areas of the brain and how dementia affects that. So, for example, someone with like frontotemporal dementia, they'll have more deterioration in the front of the brain, and that'll impact on things like behavior and maybe not being able to control impulses and things like that, rather than memory. And something else, which I think is really nice to do and to have that kind of lived experience, which obviously you can't have that lived experience, but it gives you a bit of insight and perspective into how dementia might affect somebody. There's an app where you can download and do a walk through dementia. So it kind of simulates what it's like to be living with dementia, which I really think can help people to take an empathetic and sympathetic view. So that's just a little bit about kind of how dementia might affect people at a kind of broad scale. And what interests me in the work that I do is that not everybody experiences dementia the same. Not everybody experiences any illness in the same way. Um, but people living with dementia face a lot of inequalities in comparison with other conditions. So, for example, in being able to access services, but they also experience inequalities in wider life that can really impact on how dementia affects you. So, for example, people who are facing socioeconomic challenges or maybe living in kind of areas that are facing more kind of deprivation and poverty are not only at higher risk of developing dementia, but then face extra challenges being able to access the health and social care services that they need. And the Alzheimer's Society commissioned a report on inequalities in dementia, and it identified over 100, I think 110 inequalities facing people living with dementia. So that is huge. That's a huge amount of inequalities affecting a huge amount of people. And this is not just a UK problem, this is an international problem and probably even more exacerbated in some countries around the world. I mentioned before lower middle income countries where diagnosis can be more complicated and support doesn't necessarily always exist in a lot of countries. There are issues within the UK, but there is dementia support and there are diagnostic services that people can access through the NHS. As I've talked about, there's a link between poverty and increased dementia risk, but it's not just about that risk of dementia, it's about how you support someone afterwards. So people living in poverty or disadvantage are facing a double whammy of disadvantage, which is very sad and interests me a lot. Um, Dementia affects women more than men. That's for lots of reasons, partially being that women tend to live longer than men. And dementia increases with age. The risk of dementia increases with age. And then I've got two old, footballers on there who are local. The Charlton brothers, who are very famously were England World Cup winners and both went on to develop dementia. Both lived in the kind of mining community of Ashington, so very kind of working class background, working class beginnings. Um, But also there's risks around things like head injury, and that's not that area of work I work in, but it intersects with my work. So head injury, head in the ball, and risk of development dementias had a lot of high profile media attention. So in the poll, what I found really interesting was that there was a bit of a 50-50 split about whether we can prevent dementia. So I anticipated that might be the case. So I thought I would put in a little bit of information about that that you might find useful. So yes and no. So there's research that suggests that about 40% of dementia cases worldwide can be prevented. Now, that doesn't mean that it's people's fault that they went on to develop dementia, and it means that 60% of cases can't be, but 40% is a really big kind of impact in public health that can be made. And some of these messages you won't be surprised at, and some of them are kind of a bit like the public health messaging that's been around for a long time around things like cancer prevention and also heart health as well. So there's a kind of bit of a saying, what's good for your heart's good for your brain as well. Um, and there's things that people can control and lifestyle factors in there. Um, Potentially, people may have some agency over how much alcohol they drink, how much food they eat, how much activity they take part in, whether they choose to smoke. Um, but people may have a far less kind of ability to regulate things like the environment they live in and air pollution, whether they're prone to depression, being born with a hearing impairment or developing hearing impairments. I guess the intervention is maybe things like using hearing aids and things like that. Being able to prevent head injuries and things like sports, perhaps. So some things can be controlled and some things can't be controlled. But it's that general messaging around general health and things you can do. But even if you do all these things, you can still go on to develop dementia, just like you could still go on to, say, develop cancer. But it's about reducing those risks where we can. And you might be thinking, well, that's great, but what can I do at my age? Should I be worrying about this now? Um, have a little think about what you might do now or how you might talk about this with your families and the things that they do. But the only thing that you can do now, I would say, is if you look, there's a 5% reduction. There's a 5%, sorry, increased risk if you have, less access to education, and you can't maybe control your access to education and your education, but you can control what you put into your studies and your work. And that'll impact on you in later life as well. And then the kind of lifestyle factors come in around midlife. But, if you kind of lead that healthier life and set yourself up with healthier habits, you're going to give yourself the best possible chance of reducing your risk of developing dementia, as is in accordance with the current kind of research and findings. So I thought it might be interesting to share a little bit about how somebody might go about getting a dementia diagnosis, because as I've already seen, some of you have family members with dementia. Some people might think that they might have family members who might have some memory problems or other problems associated with cognitive decline. But it can be a long and stressful journey for lots of people, and some of you will have experience of that already. And some of the work I've done has been to try and reduce that kind of stress around getting a diagnosis and having the confidence to go and seek a diagnosis in the first place. So, what are the warning signs, for example? So, I thought it might be just helpful to talk through a journey of what somebody might experience. Now, I've put a kind of like little track on the bottom with an infinity, because this is not a kind of single like linear progression for a lot of people. There's a lot of backwards and forwards, but what often happens at the start is somebody themselves or their family members or their friends or their employers might notice that the person has changed. They might notice things like forgetfulness, mood swings, um, not being able to find the right words to communicate with somebody, perhaps. So they might notice changes, usually over a little bit of time. And these changes can sometimes come on very slowly, and sometimes they can come on more quickly. For example, if someone has a stroke and then there's some obvious damage to the brain area. But often the first port of call for someone experiencing these problems is a GP, as illustrated by the healthcare professional here. The GP will then have an appointment with the person and ask them to tell them about the experiences and the symptoms that they're having. And often they'll speak to family members as well and try and get a bit of what's called a collateral history around this. So, somebody might go to the GP, somebody might say, oh, I feel like I'm having problems, I'm forgetting things. Um, I'm having to write things down a lot more. I'm worried. I'm worried about my memory. And the GP might say, okay, we'll do some assessments. Or they might say, oh, I think you're probably fine. Or come back in like 3 months' time if things haven't changed. So there's a range of things that can happen. Sometimes people will get an assessment straight away, and be asked as a first kind of protocol some standard questions designed to test memory. Now, these tests are standardized, rigorous, well known, but they might not be appropriate for everyone. So, for example, if English is not your first language, that can be problematic. If you have some sort of learning disability, these can be really problematic as well. So they're very much a one size fits all assessment. But what they can do is they can inform GPs to see whether you might need to come back a little bit further down the line, or maybe refer you on to memory specialists and to memory clinic so you can get a full assessment with more kind of tests, um, which often engage things like recall, remembering information. And lots of different aspects of how your brain works, drawing kind of things like intersected pentagons. I should have put a nice example of that in, that would have been good. And also do things like brain tests and scans and things like that, which can lead on to then being given medication, but I'll come on to that in a little bit. Um, there's kind of new and exciting things going on around biomarkers, blood biomarkers, for example, that might be able to do things around dementia detection. And I work on a project that is using sleep maths to try and determine whether people are at increased risk of dementia through sleep disturbance. So there's lots of different kind of innovative technologies going on around to try and kind of improve the diagnostic process for people, make it easier for people and get a quicker diagnosis. And a diagnosis can be really scary. This is a life-changing point for a lot of people. You were someone who suddenly was bit forgetful. Now you've got a diagnosis of dementia. So lots of people put off seeking a diagnosis. But there's a lot of work out there to try and promote the benefits of getting a dementia diagnosis. So, for example, Alzheimer's Society highlights how an early diagnosis can really help you to understand why your brain's working differently. It can help you to get the right treatments and support that you might need to live with your symptoms. And what's really important to people is any benefits or legal protection, because once kind of people's brain begins to deteriorate, as the disease progresses, people are less likely to be able to make important decisions about their lives. And I've worked on some projects that have helped people to be protected, to make sure they are enabled to make decisions for as long as possible. Uh, the NHS has targets around this. I think targets are currently around 67%. And in the Northeast, our dementia diagnosis targets are quite solid, quite good, even throughout the pandemic, which was a really bad time when lots of people couldn't access a diagnosis. That was really tricky. But they're kind of back on track at around the 67 to 70%. Um, and I just put that down on the bottom corner because people can experience a lot of hurdles in getting a dementia diagnosis. So some people experience it can take around up to 2 years getting a dementia diagnosis by the time they've been referred back and forwards. Um, and some places like that have really long waiting lists on the memory clinics and things like that. So there are challenges, but there are real benefits in people getting it timely and early diagnosis. So most of you I know I'm going at quite a rapid pace here, so apologies for that. All okay. likely to be a cure for all dementias anytime necessarily very soon, because as I said before, there are over 100 different types of dementias. But there is a lot of fantastic work going on through major charities, partnerships with the NHS, for example, Alzheimer's Society, Alzheimer's Research UK, and others who are developing drugs internationally to try and prevent people developing dementia and slow it down as well. This is very costly. Sometimes the NHS can't afford it. Sometimes it's in other countries, and it all sounds very exciting and promising when it happens. But the reality of it is that a cure is probably quite a way off, but we're getting a step closer every time with all these new breakthroughs. So I think it's really important to acknowledge that. So given that there is no cure for dementia, and this is where the most of my work comes in, is that you all really rightly identified that there is lots that you can do to support people living with dementia. And this is in terms of medical treatments, but also social interventions as well. So treatments that people can have, there are drugs within the UK. There's common drugs available to people with different types of dementia, get different drugs. So like there's common ones for Alzheimer's disease, for example. And usually people get those prescribed as soon as they're given a diagnosis of dementia. But often people living with dementia are older and often are taking lots of different drugs as well. And as people have memory challenges and problems sequencing, things like that, it can be a real challenge for people to take medication. So that's why I just put a little picture of what's called a dosette box in there. And some of you might have seen them in relatives' houses. They just help people make sure they keep the medications taken on time. And small little things are really important like this because they help people to stay independent and maintain and manage their own health. And getting information and support is really crucial. And that can help people to access a whole range of social interventions. I've signposted Dementia UK there, but there's also Alzheimer's Society and amazing local charities as well, doing amazing work. The Search, for example, just in Newcastle here, who do really great support in the community for people living with dementia. But if people have any concerns or worries about that, it's really helpful to look on Alzheimer's Society and Dementia UK websites. And Dementia UK have specialist Admiral nurses. So a bit like cancer have specialist Macmillan nurses, people living with dementia can access specialist support. And those Admiral nurses there, that's one of my good friends and colleagues, Joe there, and he's a consultant Admiral nurse for sport and dementia. So we work together over the years. And I feel very passionately, and I know lots of people feel very passionately, that dementia, because it affects people so differently, it can affect your brain so differently. Everybody has different kind of social setups. That care must be person-centered. And by person-centered, that means just not a one-size-fits-all approach. It means that you have to take into consideration what people want, how they want to be supported, what their interactions and relationships and support are, and tailoring care and support so that it meets a range of different needs. And I think that's really important around intercultural dementia care. And by culture, I speak about culture very broadly. For me, culture is more than about religion and ethnicity. Our culture is about our heritage in all different aspects. And I think that nicely leads on to some of the work that I do. And I feel that football is a very important part of people's culture. And I'm delighted that football clubs are starting to support people living with dementia. And I just wanted to share a little bit of insight into what this work involves and how it works in practice. So I've been lucky enough to work with Newcastle United Foundation since they set up a new dementia-friendly walk-in football service. And they came to myself and my colleague Alison Killen for some advice on how to deliver this. And we've been working together for nearly 2 years now. And about 6 months in, we did an evaluation of this service. So that's what I do as a researcher. I help them evaluate and improve the service. So to do that, we had some focus groups with the staff and some focus groups with the people living with dementia and carers who attended the group. And these are just some findings about the impact it has on people. So about a month ago, we'll say Billy spoke for the first time in a group setting and his wife couldn't believe it. She actually said, I can't believe you've managed to get him to talk, but I think that's the comfort of football again. He understands football. And that was the staff telling me that. And that was about a man who has really kind of lost the power of speech and he finds conversation really difficult, especially in a group setting, but he really finds it hard to sequence his words and sequence his movements, and he has Lewy body dementia. And one of the people who took part living with Alzheimer's disease said how important it is because he said you're using your mind as well as your feet. So thinking about where you should be. And so it's not just kicking the ball, it's trying to use your head and position in one thing or another. So for him, it was really helping him to maintain some of those cognitive skills that he knew he was losing, but it was helping him to do something that was physical, um, and also to use his brain in a different way by playing football. And one of the carers said to us, well, obviously football's his thing, isn't it? So that's that. And just a sense of purpose on a Wednesday. We know what he's doing and it's his thing. Now he doesn't do things on his own anymore like he would normally. It's just his thing. And that was really important because these sorts of initiatives stop people becoming socially isolated. And people can become increasingly lonely when they're living with dementia. So having social groups like this is really important to, to stop that dementia progressing as quickly, because it keeps people using their brain and using skills like that you do in socializing, talking, listening, formulating sentences, meeting new people, and give people a real sense of confidence. And if I've got time, I think I have, I'm going to attempt to share this video about Ken and what walking football means to him. Let's try it.
I used to be a postman, and then I was asked by a lord to be his gamekeeper. So I did 10 years at that. And then all of a sudden I was sick with amyloidosis, which wasn't very good. But it led to a good thing. It led to me ending up here. So how could I be unhappy about it, you know?
So we have a session on a Wednesday, which is generally for the older generation, and that's for people with a mixture of degenerative health conditions is probably the best way to describe it. Like a real eclectic mix that all come together for a walk and football session, which is brilliant.
My brother, Keith, he scouted the place out, believe it or not, to see if he thought I would like it. But at the time, I wasn't in the right place. I wasn't wanting to come out and visit people or see anyone. And he finally persuaded me to come. And to be honest, I've never looked back.
The two of them are always the first people to greet anybody new, make them feel at home, make them feel part of the group. Without them, there would be no sessions and they brighten up our day. He's sort of the joker and then Ken's more the sensitive little soul, isn't he? So before a session, we'll always go through the rules and we'll say, and what's the most important rule? And then everybody looks at Keith and he goes, have fun, and spins round. Have fun. I think it gives the people that come to the session a sense of belonging as well. And a lot of people in the session say it's the social aspect, it's getting in amongst people and getting to know new people and things like that as well.
I can't thank this place highly enough for everything that they've done for me and for Keith. It's one of the best things, that's ever happened. It's been a life changer for me. I love everything about it, and I love the afterglow that I get out of being there with it, you know. It's just unbelievably good. I've never looked forward to a Wednesday as much in my life.
So I think Ken can articulate there just how important these kind of social interventions are for people living with dementia. So I mean, with walking football, there's some physical activity which is really important as well, but that social impact is just unreal. So that's what happens in Newcastle. But the work I do was also really interested to see what is happening in the rest of the UK because dementia care is not equal around the country. And in the north, we have been quite disadvantaged sometimes in terms of access to dementia care. And I think football is a really nice way of being able to reach out to people who wouldn't normally access dementia care. So, for example, men are less likely to access dementia care, and especially men from what we think of as being kind of like post-industrial and more traditionally working class areas in the UK, where I think football can really have that reach. So there's lots of really interesting things going on through football clubs around the country and other football organisations like the Professional Footballers Association. There are apps, there's outreach to care homes, there are community groups, there's singing, there's dancing, there's football, there's bingo, there's quizzes, there's guest speakers. It's really, really great. And I've got a national survey out at the moment trying to map out what's going on within the UK. And bigger than that, around what's going on, it's about kind of all these other initiatives. And, football's not everybody's thing, but keeping active in sport, whether it's tennis there, rugby, chair exercises can just bring so many kind of benefits. And there's national campaigns around this because there's a growing kind of evidence base to show that this is really important for people and a really important way of reaching out to people. And again, these are independent organisations, and so this is not kind of costing the NHS anything or social care anything, because the NHS is in a pretty poor position and often cutting a lot of services. So these are organisations who have something really different to offer. And that is Pete. And again, he has a story about it keeps him physically and mentally healthy. And we'll come to Pete again in a minute because he's working with me now. I met him through the Alzheimer's Society a couple of years ago, and he's continued to work on my projects. And football is really important to Pete in his personal and his former professional life. And you can probably see Pete there in the middle of this lovely slide. I feel very privileged to lead this amazing research team that has a dame, two dames, professors, a load of doctors, and experts by experience. So Pete and Mick, you can see on there, they are living with dementia. And Mick's wife, Lynn, she is part of the study as well. And it's an absolute privilege to work with them. And they play a really important part in shaping our research and telling us what it's like to live with dementia and keeping us kind of like in the real world and questioning what we do and saying, actually, but it works like this. So Mick and Lynn go to the Corner Flag, which is a memory cafe at Leeds. Pete Jones is living with dementia, as I've mentioned already, and he's gone on to be an ambassador for people living with dementia, supports a lot of research, but he also volunteers at Carlisle United's memory cafe as well. So although he's living with dementia, he volunteers there as well. And I'll highlight Penny. Her husband was a former England player who went on to develop dementia, and she's also very generous in shaping our research. And for me, it's an absolute privilege to say that I collaborate with the Premier League, the Professional Footballers Association, Dementia UK, and the Alzheimer's Society, alongside the other universities that I work with. And this is just one project that I do to improve dementia support, but this is work I lead on, and I'm very proud to say I do that.